The COVID-19 pandemic is highlighting issues surrounding racial disparities in healthcare. For Shawnee County, these darker colored areas reflect where most of the county is seeing most of its cases. 13's Marleah Campbell takes a closer look tonight at those numbers and the factors leaving the Black and Hispanic communities at a disadvantage during this global pandemic.
The location of Shawnee County Health's only COVID-19 mobile testing site, Highland Park High School, isn't random.
Looking at the cases that we've had here in Shawnee County, one of the things that we identified was a large contingent of cases that were popping up on the east side of Topeka.
3 of Shawnee County's 27 zip codes hold more than half of all confirmed cases of the virus, concerning people who live in those areas, like Cherie Henderson.
Scared to go somewhere, and over here. Just scared. I don't want my family to end up with it. I don't even want to end up with it.
The neighborhood around Highland Park High School is lower income. The school's student body is 72% minority. Nationally, the CDC says minority groups are more likely to contract the coronavirus and suffer more serious complications. The hotspot map in Shawnee County reflects that trend. Black residents make up 8.5% of Shawnee County's population, but they represent 14% of the total COVID-19 cases. 12.6% of residents are Hispanic, but they make up 44% of all cases in the county.
There is an increased number of cases among some minority groups, Hispanic, African Americans, and other minority groups.
The CDC cites underlying health conditions, lower access to care, and work conditions among the reasons.
These are typically the people who work hard jobs and jobs that have the highest risk of being exposed to the virus. These are the people who kept our grocery stores open when we were all staying home, safely protecting ourselves from the virus and working from home for most of the time. So the people who work in our nursing homes, or people who work in those food production plants, and often shoulder to shoulder with each other. So when the virus starts appearing in those groups of people, it spreads very easily. And we have seen several cases linked to those kind of situations.
While work conditions play a role in why minority groups are more likely to get the virus, they don't explain why they're more likely to die from it. In New York City, a CDC study found death rates among Black people at 92.3 deaths per 100,000 people, as opposed to less than half of that for white New York City residents, 45.2 per 100,000.
You see this playing out in the disparity of the effect of the COVID crisis on minority populations. Populations that African American, Hispanic populations that are more apt to have chronic conditions.
Conditions like diabetes and hypertension, which Laura Kluke and Antoinette Coffey respectively face.
That has really put in my thought process that I just really need to be protecting my family and myself, not only because of the diabetes, but also because I am part of the Black community.
And in many minority neighborhoods, a higher risk for chronic conditions is paired with less access to health care, a dangerous combination for the coronavirus.
We have a lot of us colored people who ain't going to a doctor. Part of it, I think, is fear because what the bill is going to look back when it comes. I'm just being honest. It's fear of what it looks like when that bill comes. And when that bill comes, you can't worry about that if your life is important to you. And we know their lives is important.
Carnegie says it's why Medicaid expansion is vital.
No more vivid example can be drawn than that which has occurred during this COVID crisis.
If we don't have medical care, we can't get the care we need to stay healthy when COVID hits, when pandemics like this hit.
Marleah Campbell, 13 News.
Despite a compromise bill introduced this session, lawmakers did not debate Medicaid expansion.